So let's talk about oral contraception and venous thromboembolism, the risk of having a clot in the leg. And this is quite a huge study done mainly from a UK database. And what's it looking at? The risk of venous thromboembolism in oral contraceptive users. And you're looking at the role of genetic factors in about almost 250,000 women. What we know is about 150 million women worldwide use the oral contraceptive pill. There's no doubt there's a minor risk in the risk of increase of deep vein thrombosis, but this is most significant if you have inherited thrombophilia. So again, 250,000 women, a risk assessment done, genetic factors, and they were looked at from polygenic risk scores, as well as factor V Leiden and thrombophilic variants. And they looked at what is the chance of having a deep vein thrombosis in 2 years and the remaining years of contraception. So the overall risk, if you look at the hazard ratio, was 3.09 in the first 2 years. High polygenic risk at 6.35 in the first 2 years, and that's quite high. If you look at gene variants, factor V Leiden and prothrombic carriers, then looking at 5.73 to 5.23 as a hazard ratio. And if you combine the polygenic risk and the factor V Leiden, then you're looking at a huge risk of 14.8 hazard ratio. And that's quite high. So as soon as you put a polygenic score, you are going to lay more weight on the risk of deep vein thrombosis when you combine it with thrombophilic variants. So, why is this important? It's important because, one, it allows you to create a risk and say, what is the chance of having, a clot in the leg, and then you can decide whether or not to give the oral contraceptive and look for other forms of contraception. So from a study point of view, what are its strengths? Large sample size, long duration of oral contraceptive use and follow-up, a combination of genetic factors and clinical data, time-varying exposure. And so if you again look at the negatives and limitations of this study, it's from one bank, a UK biobank, generally healthier women, only white European women, self-reported oral contraceptive use, so that creates a bias, and it focused on second generation combined oral contraceptive pill. So if you balance it and say, what have we learned from it? And you say, well, if you're going to give somebody the oral contraceptive pill, and then it's important you review the genetic risk factors and the thrombotic risk factors, and then that will highlight the risk of having a deep vein thrombosis, and then using something that may not increase the risk is better. If you have these, then there's almost a 6.35 fold increase in the first 2 years of developing a clot if you have any of the thrombotic risk factors available. So that's it, and I think it's quite important considering the number of women that are using this. Thank you.